Hi everyone, am I audible?
Yes,
Hi
ma'am.
everyone, very good
Good
evening
evening,
to all of
ma'am.
you. Am I audible?
Yes, ma'am.
All right, okay. Uh, I arranged this session. Very good evening, first of all, to all of you. And why I arrange this session is because there are many people who are keep asking me what is new into physiotherapy and what I am doing right now, like which what I'm studying right now. So right now my focus is more, pelvic floor is always my, like this is like my love, and the second is fertility. Fertility is something which is always attracting me, and this is what I am into, and I'm reading it, and I have done some courses since 2020, and I have bit understanding. As a physio, we have a big role into it, and let's try to understand in this introductory session that what is fertility and what is female infertility actually. So what is fertility, what is infertility, and what is female infertility and male infertility. So normally my focus is always about more about understanding the female infertility, because I understand a female body. Me myself is a female. So uh, please mute yourself, everyone. Audible? Yes. Am I audible? Because you guys are not audible to me, I don't know.
Yes, yes, ma'am, you are audible.
All right, okay. Okay, so let's try to understand what is fertility. Fertility means, if you just want to go
Madam,
through
audible.
the, please mute yourself, everyone. Mute yourself so we can have a undisturbed session. Yeah. Okay. Yeah, lovely. So let's try to understand what is fertility. I am a girl and I can get pregnant. I can conceive. I can get pregnant. I can give birth to a healthy child. So live birth is there. So it's a fertility. I can fertile. Infertility means there are, like, I'm trying to conceive since many months. It's not only 2 months and 3 months. I'm trying to conceive seriously from last 1 year, but everything is normal or might be some issues are there. I'm not able to conceive. When female and when the couples, they are trying to conceiving since last 1 year, but she's not able to conceive, we call it as an infertility. So when we talk about the infertility and conception, we always know that as a women we are different because we have uterus, we have our ovaries inside. Like we have ovaries are having eggs. Same way males, they are having a testes. Now there's a difference between male and, like, male and female primary reproductive organ is that in male testes, they can keep producing the sperm every day. They can produce sperm every time the testes are producing sperm. But when we talk about female ovaries, so like we cannot keep producing this our ova or our eggs. We are born up with the eggs. So this is the fact. We can't create new eggs in our life. Whatever eggs are there, we born up with the eggs. So this is a very, very important things, the difference between male primary reproductive organ and female primary reproductive organ. So if we are talking about the egg and the sperm, so sperm can be always production throughout the life of a male, but female, we are born up with the eggs. One day the eggs are gonna go, like, they are gonna spend all the eggs, and, like, there will be no egg in our uh, there will be no egg in our ovaries. So this is a basic difference. Now when we talk about, okay, Dr. Ayush Kumar is requesting AI companion. I don't know what he's trying to do. Okay, I accept it anyway. All right. So what is female reproductive system? This is very, very important to understand when we talk about fertility and when we talk about infertility. So today's session we will focus on female body, and for female body try to understand the reproductive system. What are the organs important for reproduction? So primary reproductive organ, if I'll ask all of you, so I think most of you know the answer that primary reproductive organ is ovaries in a female body. So we have two ovaries, we have two fallopian tubes, we have one uterus, we have one cervix, and that cervix is attached with the vagina. So all together, these are the organs which are present in our body. So, like again, this is a small model I have. So let me show you through the model. So this is a model of a female reproductive system. So this is the uterus, my uterus. This is the vaginal canal, and over here we have the cervix is present here. We have two fallopian tubes, which is attached with two ovaries on both sides. So this is normal reproductive system of a female. Out of this, these ovaries, two ovaries, yeah, sometimes the female can, not everyone, most of them, we all are having two ovaries, but sometimes female can be present, they can born up with one ovary also. So yeah, that is a kind of, no, it's gonna somewhere affect their fertility, but they can get pregnant because both ovaries are functional, and if one is not there, other can be functional. Okay, so in both these ovaries, like when I was in my mama's tummy, at this when the female was in womb of a mother, the same time, the God has given us millions of eggs in both the ovaries. So this ovary and this ovary, we born up with eggs in that. For example, we have four leg eggs. I born up with the four leg eggs in my ovaries. So you can assume that half will be present into this one and half will be present into this one because we have two ovaries. So four lakh ovaries, like I can be present with the four legs, someone can be present with the three legs, someone can be present with the five legs. So it can be the number of the eggs can be different in different female. Genetically, the factors can affect. Okay, so might be someone is having only two lakh eggs, or someone is having five lakh eggs. So that proportion can be different in different females, but definitely we are born up with eggs. There's no female who is not born up with egg. Yes, if the female she's born up with the eggs with the less into number can be less. For example, in my account, my bank account, there might be less amount of money. In your account there can be more amount of money. So whoever is having more money, she can spend for a long time, and who is having a less money, she can, like, she's going to finish all the money very soon, because every month we are spending X. So out of this 4 lakh X, if you just say, like, if you try to understand, and up to puberty, like, I born up or the girl born up to puberty, most of the women's, they're gonna, like, spend some eggs. So it's not a like menstruation process and development process, it's automatically atresia is going to happen in her own body. So some eggs are gonna go away before we reaches to the puberty. Once we start with menarche, the first period, when the first period comes in our life, and through this, it means all the eggs which is present into the ovaries, now these eggs has to start getting developed, and they have to start giving its functionality. So what is the main function of this eggs? Why the egg is present? Reproductive organ, so they want to do reproduction. So all the eggs has to get mature, and they have to go in their appropriate places. When the egg will mature, it will go to the fallopian tubes. Into the fallopian tubes, the sperm will come. Now the fallopian tubes are the area where the fertilization is going to happen in the, because they have the right temperature, right environment where the fertilization oocyte development can do. So this is a complete process. So whenever we have this kind of two, like, what the eggs are maturing, they will go to the fallopian tubes. After fallopian tubes, the eggs will go to the another reproductive system, which is the uterus. Into the uterus, we have endometrium. Into endometrium, the egg will implant, and the formation will start. After implantation, placenta will begin. Placenta will become a gland. It is going to give a support to the baby for the development. Once this all process is going on, cervix cervix will also come into picture. Cervix will try to create a good thickening of the mucus, so baby should not fall down as per the gravity. Vagina will also come into picture. It will try to increase the mucosal secretion inside. So or even the vulva will go for you can say that some kind of swelling effect or some kind of mucosa, all the glands or all the glands in the structure of the vulva and everything will go for it will behave as a supportive structure. So starting from the ovary where the process starts, the fallopian tubes, uterus, cervix, vagina, vulva, everything is very very important. Over there we have a pelvic floor muscles, so they are also gonna stretch, and the effect will be also there on those structures. So now when we understand the fertility, like it means everything should be functional. I don't want any issue with my ovaries. So the what issue can happen with the ovary, that female don't have enough amount of egg to produce. So if we don't have egg inside the ovary, because nowadays, if you try to understand that we girls we are more focused on our career, so most of the time we are getting married at a very late age. If the girl who is getting married at the age of 30 and 35, and we, like unfortunately she was just only born up with like 3 lakhs eggs, so she might be at the stage at when she's at 35, 30, more than 30, 35 years age, like she don't have sufficient amount of eggs like remained in the ovary. When the eggs are not there and less amount of eggs are not there, so we call it as a ovarian insufficiency. When your ovary don't have egg, it means we get pregnant, isn't it? So please mute yourself. Let's have a disturb session, please. Sagar, can I remove you from the meeting, or you want to mute yourself? Sagar, can I remove? So please mute yourself. Okay, so ovary is very important. So the number of amount of eggs present into the ovary is very important. And what is also important, ovary should have enough blood supply. It should have a good vascularity. So that is also very very important. The ovary should be freely suspending into the pelvic area. We don't want anything, any adhesion, any scarring, any obstruction which is formed over the ovary and which is not letting the ovary to release the egg. But if the egg will not be released, ovulation will not happen, egg will not be picked by the fallopian tubes. So ovary should be very very healthy, good vascularity, better blood supply, no adhesion, no scar, nothing should be affecting, no obstruction over the ovary should be there. And the second, ovary should have enough amount of eggs. So that is very very important. Now we cannot increase the number of egg, but we can always improve the health of egg, because there are two factors which is affected, which is very very important. The egg should be healthy egg. We don't, so the healthy egg is going to get mature early and faster. So we want mature and healthy egg. And for mature, if I really want to become healthy, I have to have a good food. So good nutrition is something which is very, very important. And good nutrition comes with the better vascularity and better system of the body. So that is very, very important to understand that blood supply should be good. So you all can you we can also understand that as a physio, we cannot forget about the facial sheath, the peritoneal cavity, the everything. Whenever we talk about the facial sheath, so everything is connected. So anything happen in your abdominal cavity can create some restriction onto the ovary, and it can disturb it functioning. So any scarring, any adhesions can definitely disturb that. It can create an obstruction and it can disturb its functioning. So ovary is very very important. And the second is, into the ovary we have egg. For the egg development, very it is very important that we should hit puberty at the right age. Sometimes there can be delay into the puberty, some factors can affect. Between nowadays we saw that 7 to 14 is the age when any female can hit the puberty. So whenever we are hitting the puberty and menarche is coming, first time period is coming, so after that this continuous development of egg should be there on a regular basis. We all can understand that sometimes irregularity of the period can happen into the initial time when body is trying to adjust 1 year, 2 year, but after that it will settle down. If I start with my menarche at the age of 12, so I might not get that when I'm having the regular cycle. Becoming the cycle regular, it can take 1 or 2 years, but after that it is going to get regularized. And why the regular cycle is important? The regular cycle is important to get the exact time of ovulation day. We will be able to understand when I am ovulating, so that is also very very important. Sometimes this cycle cannot be regulate, and there can be some factors which is affecting it. So what factors can affect the, like if you ask your mama or if you ask your grandmother about one condition, like have they ever heard about the word PCOD? So the answer will be no. They will be. It will be. They will be very surprised that they never had any issues like PCOD and PCOS. But nowadays, every one female out of five, they are suffering from PCOD issues. In this PCOD, polycystic ovarian disorder, like they are not ovulating. They are not. Their cycle is not regularized. Why this PCOD is there? Why your ovaries are not functional? The factors behind that is your, what we say is a all this glandular function. So we have the glands present in our body. These glands are releasing hormones, and hormones are that factor which is helping into the better maturation of the egg. So whenever there's a hormonal disturbance, so we can understand, and these hormonal disturbances are affecting that production of the egg. So definitely, like the periods can be irregular periods. So the hormones are very very important. So if well, the hormones are coming from all this, you can understand that all this hypothalamus and pituitary axis actually. So we have three important glands in our body for our reproduction. So first is for our periods, for this development of that the eggs, and which is affecting the ovaries. So those hormones are like kind of, it's a communication. So you can see that we have three important glands which is responsible for everything. First gland is the hypothalamus. So hypothalamus is that gland which is under the fact of growth hormones. So it keeps even sometimes secret, depending upon what type of growth is happening in a female body. So that is going to create a growth of the reproductive system during the puberty time period. So the hypothalamus is responsible for the growth of the fallopian tube, the enough size of the of the ovaries, good size of the uterus, all reproductive system, the tract. This tract was not of this optimum size in the age of 2 years of girl, 5 years of girl. Once the body is getting developed, reproductive system is also getting developed. So this is very very important to understand. Just be with me just 1 minute. So any factor which can affect the hypothalamus in our life can definitely gonna affect the fertility of a female. So hypothalamus is gonna release some hormones like GnRH hormone that will trigger the pituitary gland, anterior pituitary gland to secrete follicular stimulating hormone, luteinizing hormone. Those hormones come to the they will react onto the ovaries, and ovaries will start developing the all these eggs inside. So this is a whole axis. The body is working into this type of axis. But if this axis is disturbed by some reasons, now what can affect? Something can affect your hypothalamus. Factors can affect our pituitary gland, factors can affect our ovaries. So whatever factor which is affecting any of these glands, so they can definitely affect our development of the eggs, or our ovary, release of the eggs from the ovary. So this PCOD, when we talk about the PCOD, in PCOD, which is when the ovulation, you cannot track, the cycle is not normalized, not regular. So you cannot track when you are ovulating, and ovulation day will not be there. So once you cannot track when you are ovulating, so there can be difficulty in getting fertilization, because for fertilization we should be getting the exact day when I'm ovulating. Because the another truth, the hard fact of the universe is that the egg is going to release, and egg is going to be there into the fallopian tube only for 24 hours. So it is only for one day in the whole month egg will be there in our fallopian tubes for fertilization. If we will miss having a sperm in that day, we cannot get pregnant. So we should not be missing that particular fertility window. So every female should be getting the fertility window, but we just to for that we should have a regular cycle. If my cycle is 30 days, someone's cycle is 21 days, 28 days, someone's cycle can be 25 days. So out of these 25 days or 30 days, only one day the egg is there for the fertilization. So this is the issue coming into the PCOD, that they cannot understand, they cannot track when the ovulation is there. So now this PCOD can definitely affect that conceptional day, fertility day, and it can disturb the fertility window. So that's why it can be hard for the female to track her fertility day. That can be issue. Second, in PCOD there can be all the there, the PCOD is some other day we will understand PCOD, because again it's a very very big topic. But I'll say that many eggs into our fallopian tubes, into our ovary every month, there should be one mature egg coming at the end for fertilization. But in this ovary, if one mature egg is not there, many multiple eggs are trying to get mature, and no one is healthy. They are all immature, unhealthy egg staying there into the ovaries. Some factors are affecting them. They are not letting them to luteinizing hormone. There are different hormones which can affect their production, or they can stuck in one position and they cannot develop more than that. So many small cyst like formation will start coming into the ovaries. So this is what is polycystic ovary. Many cyst, instead of many cyst we should have only one healthy cyst, uh, not one healthy egg coming for the fertilization, for the ovulation. But many eggs are developing inside, and no one is healthy enough to ovulate, and they are stuck into the ovary. That there's different hormones which is affecting them. So hormones are something which is really very important when we talk about fertilization. If you don't have healthy, like if there's no development, no mature egg will not ovulate. Okay, if egg will not ovulate, there's no egg, you can't get fertilization. So this is the reason that ovary is very important, and ovary gonadotrophic axis is very important. The hormones which is affecting the ovaries are very important. The number of eggs which is present inside the ovary is very important. How free the ovary is very important. How vascularized the ovary is very important. How much good blood supply is there is very important. So ovary is a very important part of our life, and there are two ovaries which is like in our body. So when you will try to understand, when you will when you will think that you really want to walk into this field, so this is the first thing, the first organ which you have to start exploring: ovaries. And this is going to give you more clarity how the ovary are responsible for infertility, because this is that fact that if there is no egg, you can't get fertilized, and egg is coming from the ovary, so ovary is very important. The second factor which comes here is the fallopian tubes. So these are two fallopian tubes which is present, and these fallopian tubes are somewhere. We have three different types of that. Three different part of the fallopian tubes, and this fallopian tubes has a very important role and functioning into fertility. So now what happens here, because what happens here is that in these fallopian tubes we have these fimbria like structures. They have to be the responsibility is to pick the egg from that ovary. Whenever egg is kind of coming, ovulation is going on. So after ovulation they should be free enough, they should be mobile enough to go towards the ovary and to pick the egg. And once, so this quality, this is very important, this functioning is very important. So picking the egg from the ovary. So you can understand, if this ovary is under some obstruction, there is some kind of scarring present onto the ovary or onto these fallopian tubes, they cannot move from its space and positioning, they cannot go towards the ovaries, so they cannot pick that this egg. So the fallopian tubes are very important, and mobility of the fallopian tubes are very important. They are not always in a connection with the ovaries. For example, this is the ovary and these are the fallopian tubes, these are the fimbriae of the fallopian tubes. You can understand why this whole hand is a fallopian tubes, which is attached with the uterus. So this part is the uterus, and these are two fallopian tubes, and these are the fimbriae. So they should be kind of mobilized everywhere. Movable mobility is very important inside. But if something is affecting the mobility and I'm restricted, I'm stiff, restricted in one fixed position because of some adhesion, some scarring, I can't move further just to go towards the fallopian towards the ovary to pick up the egg. So you can understand, egg is, ovaries can't move, they will be staying in a fixed position, but the fallopian tubes are creating this mobility towards and outwards depending upon the hormones luteinizing surge. At that particular time, these ovaries are coming closer to the these fallopian tubes are coming closer to the ovary, and they will pick the egg. So this movement is very important, picking up. And any factor which is restricting the movement of that fallopian tubes can definitely affect. Now what factor can affect, like positioning of the ovary? If ovaries are not positioned near to the this fallopian tubes are not positioned near to the ovaries, they are, for example, they are falling backward. Like these fallopian tubes are attached with the uterus. If uterus is positioned in a right way, they will be, the fallopian tubes will be on the right way. But if the uterus is falling backward, the fallopian tubes will also go backward, they will move backward. So this is what happens into the retroverted uterus. So this is again a position, the uterus should be into the anteverted anteflexion positions. Anteflexion, anteriorly flexed uterus, is a right position of the uterus. But once they are present anteriorly, it means the fallopian tubes will be also present the same way. But once this uterus is falling backward, it means that is going to pull this fallopian tubes away from the ovaries. So in this case, might be ovaries are functional, they are ovulating a good amount of good mature egg, hormones are also good, everything is good, but these fallopian tubes are away, they are not ready to pick up. They're far away from the ovaries, the fallopian tubes. So they cannot pick up the mature egg. Egg will come from this ovary, okay, after ovulation. But this egg will be wasted egg. The atresia of the egg will happen inside the abdominal cavity. This egg will fall into the abdominal cavity and it will dissolve after some time. So this is a wasting of egg every month. So this can happen once the fallopian tubes are away from that ovaries, and they are not mobile, they are not able to come towards that because of some restrictions, which is some scarring, some pulling to that. So what can create this pull and scar? Any trauma, like if the female has had a fall in the childhood and she had some kind of surgery, so things can change that shape of the organ inside. The internal injuries, they can create a adhesions and scarring. So she, the poor girl, she don't know that what type of fall she had in the childhood. So the organs are falling back. We don't even go for scanning most of the time. We don't know what type of uterus we are having in our body. So so sometimes we keep having this kind of issues that I'm not able to get pregnant. And once we'll go to the doctor and they will do the scan and they do the transvaginal examination, they will find out that, oh, you are having retroverted uterus. So we might get to know about that during that scanning when we really want to get pregnant. So it is very, very important that this type of scarring and this kind of repositioning of the organs can also affect the fertility. So fallopian tubes are important. So this is what I told you, that how some other factor, abdominal content, other factors can create a scarring onto the fallopian tubes on the outer surface, outer pituitary cavity of fallopian tube. There can be the female, they don't want up with the fallopian tubes. If the female don't have fallopian tubes, so you can understand, it means the egg cannot come here. And if the egg, because they don't have absence of the fallopian tubes, so this is a kind of congenital malformation in the reproductive system, that she has a uterus, she has ovary, but she don't have, might be fallopian tubes present. Or it can be one fallopian tube is not present, that can be also happen. It is a congenital malformation into the reproductive system. So when this happens, no fallopian tubes, so you can understand that no, she can't get pregnant naturally. But can she pregnant? Yes, she can pregnant. The doctors can take an egg from the ovary, they can take a sperm, because what these fallopian tubes are doing, they are doing the work of fertilization, meeting of egg and sperm. Sperm will also come into the fallopian tubes. It will stay there because it has a good environment, good net temperature, where sperm can stay up to 5 days. So look, this is again, sperm can stay in fallopian tubes for 5 days, and egg can stay only for 1 day. So this is what we call it as a, like, fertility window. Like, we have to have a sperm in that particular time when egg is coming out. So having sex in that particular time period and intercourse into that particular time is also very important. So you will get this understanding. Well, you will have more interest to understand the reproductive system and all this, anatomy and physiology and the process of fertilization. So this is very, very important to understand the fallopian tubes and its important. Now, importance into the fallopian tubes, we have a, like, some kind of cilias present, and these cilias are responsible for the mobility. So sperm will be moved from uterus, because sperms are coming into the vagina after crossing the cervix. They will come into the uterus. After that, they will come to the fallopian tubes. So this kind of mobility should be there into the organs. So this cilia should be mobile to push the sperm into the fallopian tubes, and cilia should be also mobile into the fimbriae to push that egg towards that particular area where the sperm is waiting. So this type of mobility we need inside the tube also. But this mobility can be again restricted with many factors. So if any injury happen, some kind of infections happen, some kind of inflammatory disease happen in our body, it can be some, you can understand, endometrial tissues can go into the fallopian tubes. There are small tubes. They don't have a big diameters, very mild diameters they are having. Into this mild diameters, only sperm cells and that, you can understand, that ovum cells, they can only enter. So you can, if there is some obstruction into these mild tubes because of endometrial tissues, because of some, like, you can understand, the fibroid formations due to some scarring, because of some injuries. It can be some, like, some inflammations or infections which can affect this cilia. They can definitely create obstruction into this small tube. If obstruction will happen, so you can understand, depending upon where obstruction happens, which part of that fallopian tubes, they might, if this obstruction is towards that uterus, so might be sperm can't go there. Egg is coming, so that area is okay, but sperm can't come, so again she can't get pregnant. Or if this type of things happen into the other way, when the egg has to come, that other part of the fallopian tubes from where the egg is coming, so like towards that fimbriae, if that is damaged, so you can understand, sperm can be there and can be waiting, but egg cannot come. So this can always affect that mixing of both. So fallopian tube is something very, very, very important, and as per the studies, 40% of the infertility is because of the fallopian tube blockage. So when the fallopian tubes are blocked because of adhesions, because of scarring, they don't have mobility, they are away from that ovaries. So fallopian tubes are a big, big, big responsible factor. And so we have to understand the fallopian tubes. And after that, the another structure comes is a uterus, very important. Uterus is always under the effect of hormones. So whenever hormones are coming, good amount of hormones will be there, good development of the egg will be there. So we can understand this egg will um, increase, this estrogen will be there. Estrogen is going to increase the thickening of the endometrium. So we need an optimal level of estrogen. We don't want too much of estrogen in our body, and we don't want very less estrogen in our body. If we have a less estrogen, because eggs are not developing in case of PCOD, for example, if eggs are not developing, so there might be less amount of estrogen. If less amount of estrogen, the endometrial thickness inside the uterus will be less. So if endometrial thickness is less, you can understand that that endometrial will not be favorable for the pregnancy. So might be fallopian tubes are good, but if fertilization might be also happen, the egg will come here for fertilization, but endometrial thickening is not there because of less amount of estrogen. So hormones are responsible for this uterus and endometrial wall thickness. We don't want too much thickness inside that also, because if too much of estrogen, it can again affect the body in a different ways. It can create a hyperplasia of the uterus. So this whole functioning of the uterus should be also very, very good. So we have to understand that. And there can be other factors which is affecting. The one is a congenital factor, like you don't have a good size of the uterus, it is a smaller size of the uterus, the structure is not expanding, again and again she's getting miscarriages because the size of the uterus is not good. So those it can be a lot of fibrous tissues inside, it can be less endometrial tissues are forming, more endometrial tissues are forming, a lot of swelling are going on inside, vascularity of the uterus is not there, blood supply is not there. So there can be many, many factors which can affect that. There might be two uterus present, there might be two cervix present. So it can always affect our fertility. Other thing is, yes, so that is important. After the uterus, the other part which comes here is the this cervix part. So this ovaries are important, fallopian tubes are important, this uterus is important, and the cervix. Cervix is approximately 4 centimeter long organ which is present, and its more important functioning is creating the closing and opening. We have a thick mucus present inside, and this thick mucus is responsible for giving support to the growing baby inside. When female is fertilized and the implantation happen, and babies keep growing on, at that time this mucus should be thick enough. It is like a door, so this door should be closed. When the door is closed, baby will not it will not gravity will not act on the baby, and baby will not slip out of the womb. So it is important for good complete pregnancy. If this cervix, the size of the cervix is not sufficient, assume the size of the cervix is approximately 2.5 centimeter or 2 centimeter, or so this is this condition which we call it as a cervical insufficiency. So this type of cervix can give, so it is not an infertility problem, but it's a pregnancy problem. So female cannot give birth to the live baby, because the cervix might get open up in between the third month, fourth month, when the baby weight will start getting bigger into the womb. So the because cervix is not strong enough to hold the weight of the growing baby. So cervical insufficiency can be the reason of miscarriages. So we should also understand that cervix as well. And the last is vagina. So we all understand that this is a vagina. Most of us, we count vagina as a sexual organ, but instead of sexual organ, the main functioning of the vagina, it's a part of reproductive system actually. For sexual, as a sexual organ, we have a different organ present in our body, that is a clitoris. So vagina is not a sexual organ of a female, clitoris is a sexual organ of female. So the vagina is a part of reproductive system. What is the role of vagina? the role of vagina is collection of the sperm. So we should have a entry of that male sexual organ. Penis should be entered inside, and ejaculation should happen inside the vagina. And vagina has a favorable circumstances, a favorable pH level where the sperm can sustain and survive, and it can collect the sperm, and the sperm can go towards the, by crossing this vagina, they can go towards the cervix, and from that uterus they can go towards that uh, uh, fallopian tubes. So its main important part of the vagina is collecting the sperm. So vagina should also has a good ecosystem, good environment. We don't want very dry vagina where they don't have a like kind of moisture inside, and acidity of the vagina is very high. If the acidity of the vagina will be high, we all understand that what we can say is sperm is alkaline into nature, and if the vagina will be too much acidic, it will, or not favorable for the sperm, it will kill the sperm. So vagina it should be also good. The environment inside the vagina should be also good. So some infections can some inflammations can always trigger its functioning. Okay, so it's also important that we understand the vagina. And after that, another thing comes, there is the pelvic floor muscles. So pelvic floor muscles are present at the base of that uh, base of this, or these are the pelvic floor muscles. So you can understand they are present at the down bottom part. And if this pelvic floor muscles, assume that this my finger is a vagina, this is vagina. So if you cannot go inside, so penis can't go inside. If the penis will not go inside, ejaculation will not happen, sperm can't enter. If sperm will not enter, might be everything is good internally, but if the pelvic floor muscles are tight, you can't have intercourse, you can't have penetration of the penis inside. So ejaculation of the sperm will not be able to go inside. So this can also affect fertilization because there is no sperm. You can't have intercourse. So tight pelvic floor and some kind of spasm into the pelvic floor can also affect fertility. So you can understand, and after that we have a vulva externally, and if the female is having some kind of vestibulitis are going on, infections are going on all the time, so these kind of things can always be they can also play a role, because if inflammations are there, some kind of bacterial infections are there, so they can always affect your whole track, and it might kill the they're not favorable for the sperm, they might not be favorable for the whole internal system. So understanding that starting from the hormonal level, and that this how this fallopian tube, this ovaries, the ovaries health, fallopian tubes health, uterus health, cervix health, and then we have a vaginal health and pelvic floor health, they all can affect a female fertility, or they can give any factor which is not good, they can give rise to the infertility. And now you can understand that what we can do, what is the role of physiotherapy in that. I just to understand the role of physiotherapy, I will share one link into the group. I want you people to understand that one team of physiotherapists who are working into they are working in US uh, since 1990. This group is working, and they are fantastic. They are all physiotherapists, and they are treating the fertility. And what they are saying, that even I also believe that, because in this whole year I got approximately seven success stories which I treated female infertility with my physiotherapy, and there are seven success stories of that in this whole year. So that's why I think that if I can do, why you can't do, and why as a physios we should not try to explore these things. So please go and study Clear Passage. Clear Passage is the name. Okay, you can write down Clear Passage on the Google, and please go and see their work. They all are physiotherapists, and try to explore, try to find out some research, because research and studies are showing that we all understand nowadays whenever infertility is coming. So one thing, IVF is very common everywhere, at every corner of our street. Many IVF centers are nowadays, you can see every doctor is every gynec is getting this kind of expertise in reproductive health medication, or fertility health. They are going into that because they understand that today era is a where female is struggling with fertility. The first factor is the aging factor. The second factor, we are getting married at the late age when we don't have a good enough amount of the eggs. Might be our health is not as healthy as the. You can also always understand the female who's at in the age of 20, she will be more good health, healthy female as compared to the female who's into 35. The egg and the system of a female body will be more healthy at the age of 20, 25 as compared to 35 and 40. Most of the female, they are getting married at age and they are getting mother at the age of 35 and 40. Sometimes the eggs are not there, sometimes that health is not supportive, sometimes the hormones are not supporting. Sometimes the psychology is the factor. A lot of stress level is affecting the female. The periods are not right, so anything can affect them once we keep growing in our life, because experiences which is affecting our mind. So if the good experience, okay, but if we had a bad experience in our life, so it can always give me stress in my life, it might always affect my fertility. So now IVF are a lot of IVF center everywhere, and believe me, simply this is what I understood, that in my life, females, they don't even know when they should have a sex. So throughout these 30 days, you can't have sex every day. Yeah, you can have sex every day, but if you really want to get pregnant, don't miss having the sperm on that particular fertility window. So some females, they are not aware about their ovulation day also. So there's lot of lack of education, lack of awareness, lack of our own body understanding. Females are not aware that the education has not been given, what has been transferred. We are not. Most of the females are not even aware about the fact that egg is there only for one day, so they should not miss that having sex during that particular time period. So there are many simple things which we miss in our life, and which can be a cause of can be cause like she's not getting pregnant. So starting from this small cause to the big cause, when like we have a retroverted uterus, some adhesions are there, scarring is there. So as a physio, believe me, we can give exercise to our patient which can improve that kind of movement inside. So it is just increasing the mobility, internal mobility. So if we can think about the piriformis, and we can think about the iliopsoas, and we can think about the pelvic floor. So so it's all deeper muscles, like all this. We can understand the diaphragm, which is a deeper muscle. You can't just go and palpate the whole abdominal diaphragm. So you can understand the muscles are inside, and if something happen more deeper than that, it's all about the mobility. So we can give exercises to the female which help to increase the mobility into the abdomen, around the reproductive system. And if there's any kind of restrictions internally, we can work onto that as well. We can try to improve the blood supply by giving the strengthening exercises, by giving them some sort of heating, and there are other things as well. So whenever you will be more interested in learning about the fertility, you will explore more about that women, the role of physiotherapy, because this is like the idea which we have to cope, like whatever we are doing in any cases, whatever modalities you are having, how to help in case of PCOD, how to help in case of scars formation, adhesion formation internally, when the restrictions are there internally. So it is all about increasing the blood supply and increasing the mobility towards that reproductive track, and creating the more awareness into the society about the right and normal reproductive system. And every female should be knowing about that fertility window. So this is like small introduction today I wanted to give all of you, that to try to explore this field. And believe me, before when I started pelvic floor in down the road in 2015, there was hardly no one doing pelvic floor. But at this 2024, pelvic floor rehab is like somewhere we all of us we must have explored. And the same way, the future is fertility, and try to look into this subject. And this is what we are keep advancing ourselves. And the physiotherapy is a progressive field. It's not only treating limited to some part. We are always progressing in our field. So let's explore fertility as well, and same way male fertility as well. So in down the road we'll talk about the male fertility, because still I don't have that much of understanding, because I'm still learning. And but any one of you who is interested, explore the field, and believe me, down the road 10 years, like this clear passage people, they are saying that success rate of IVF is approximately 21 to 35%. If you look anywhere in the world, any corner of the world, so the success rate is 21 to 35%. But if we talk about the role of physiotherapy in improving the fertility, so it is uh, approximately 67%. So you can understand the IVF, the success rate, and with the fail cycle, again 3 to 4 fail cycle, and which is the fact this IVF is really affecting a female health, because lot of hormones are given to her body. So like too much of damage to our internal system. So you can understand IVF is having a side effect, and with this side effect, with the failed cycle, there might be the success rate only 21 to 23 to 35%. But physiotherapy, success rate of physiotherapy in improving the female infertility is 67%. It's a big and huge number. So I really want you to please explore the field. I'm not the expert, but let's be expert by exploring it all together. And whoever is interested, please come and explore this field. Thank you so much. This is what I really wanted to give you today. And just to understand that I have a kind of comprehensive program which I have developed. You can definitely join me into female. Just I'm also trying to give you online education about the female fertility. I will try from my level best. So where you will understand the anatomy, physiology, and problems, and the role of physiotherapy step by step. Whatever the way I'm doing on my patient, and how I give this successful 7 fertility fertilizations to my women, and same way I can teach you that things. Or now I'm also planning for hands-on workshops in future. I'll just try to do my level best. So yeah, you can join me if you are interested in that, or you can learn by yourself. Okay. Thank you so much, everyone, for joining me today, and hope today's sessions has added bit value, and it might trigger your thinking that oh, we can explore fertility as well, and we can help into female infertility and improving the fertility. So thank you so much, everyone, for joining me here. And the group is open, and you can ask me questions in the group whenever it comes. And when you are starting learning about the fertility, and if you came across something, please forward the stuff with me also, and personally. So let's learn together, let's explore our future together. Thank you so much, everyone.
Thank you, ma'am. Thank you so much.
Thank you, Dr. Pooja. Thank you. Let me go through some questions if they you are having. Yeah, dear.
Thank you, ma'am.
And IVF is too much expensive also. True. And lovely. So, all right, girls and boys, everyone, thank you so much for joining me. Bye bye. Take care. Anything you want to say right now, you can unmute yourself, and we can talk for another 5 minutes if you want. Any question? It was just basic introductory session today. But, thank you so much, everyone. Physiotherapy for male infertility, Dr. Kalyan Dey. The first thing is we have to understand that in a deeper way. So definitely I'll come with another webinar, more prepared. I'll prepare myself so where I have a more clarity to answer your question. So yes, physiotherapy can be there to improve the sperm quality. If we think about, okay, or ejaculatory force, pelvic floor is very important. Pelvic floor rehabilitation is very important for increasing the ejaculatory force. So that there can be some factors where we can explore in male fertility as well. Do we have a role into cervical and cerclage? Dear, look, cervical and cerclage means when the cervix size is not optimal during the pregnancy, and just to save the baby inside the womb, the doctors are doing some kind of clamping at the base of this whole cervix. They clamp, they tie the cervix, and this is the cervical cerclage. Now, the role of physiotherapy in this, yes, there is a role, because if you see in the books, in our physiotherapy books, it is written that physiotherapy is contraindicated in cervical cerclage. Okay, it is written into books that we should not do physiotherapy if the patient is suffering from those kind of cervical insufficiency. So physiotherapy is contraindicated, but I'm completely not believing this. And I feel that whenever there is a cerclage happens, doctors are giving a female complete bed rest, because just to avoid the gravity, because they close the door by this kind of stitches, by putting the stitches around that area, by getting this kind of cerclage. But this cerclage and this procedure, yes, it is very important to save the pregnancy for the sustain up to the seventh month, the eighth month, the ninth month, so baby can grow,
Yeah, ma'am.
and then they can take the baby outside. But what is our role? Doctors are giving her a complete bed rest. So if the complete bed rest will be there, so you can understand what will happen with her whole body system. So there will be a lot of edema in the legs, there will be a lot of compressions, nerve compressions, subtle compressions, there will be a lot of back issues, back pain issues. So definitely physiotherapy can increase the movement or circulation of the whole body whenever the circulation happen. We cannot do anything with the circulage, but we can take a body as a whole, and whatever complications is going on in her body due to cervical circulage, due to this procedure, because she will be on the bed rest. So whenever she's in the bed rest at the age of at the time of fourth month and fifth month, when this procedure happen, you can understand she still have to go through 3 and 4 another month to sustain the baby. For 3 and 4 another month, what will happen with the baby, with the body of a female in this immobilized position? So physiotherapy has to work with the movement, increase the mobility, increase the blood supply, and increase that better breathing and better health of the person. So physiotherapy has a different role, not directly onto the cervical circulage, but the whole body. We have a role. Okay. Yeah, you cannot do anything to increase the mucus, you can increase the length of, no, that you can't do anything with that, but you can take care of other health.
Ma'am, can we have more sessions like this?
Definitely, I'll keep having more sessions like this, because this is what I really also want to do. Let's have some kind of understanding whatever is new. If I explore something, I'll definitely keep having sessions like this in future. This group, I will keep sending you information.
Thank you so much, ma'am.
Thank you so much, dear. Uh, any exercise to correct? Any exercise to correct what? Okay, let me go through the questions. Physiotherapy more male infertility. Dr. Kalyan will definitely have one session for this. Do we have any role in cervical? Okay, done. An exercise to correct. Okay. Any specific exercise for the infertility? First we have to understand what is the cause of infertility. Depending upon the cause of infertility, we can plan that. Okay, if it's the restriction, so stretch exercises are important. If it's a vascularity
Pushpa.
problem, not a better blood supply, so it means that circulation exercises are important. So depending upon what is the cause and what is the reason for the infertility, according to
नहीं
that.
रख देना इसमें पीला बन जाएगा.
Okay. Ma'am, after C-section, diastasis recti will occur within 3 months. What will be able to do, ma'am? Occur within 3 months. What will be able to do, ma'am? So rehab for diastasis recti, dear, for this. So we have to understand what is the diastasis recti. This is not a small topic again. Diastasis recti means that rectal sheath which is present inside that linea alba, the connective sheath. So this connective sheath goes into that stretching and separation when the baby is growing up into the uterus. So mostly everyone, whenever we are getting pregnant, everyone's their tummy is getting bigger, isn't it? So every once the linea alba is stretching, every once this transverse abdominal muscle is going bigger, bigger, bigger. It's going under the fact of stretching. So there are two transverse abdominal muscles, and when they are moving, because baby is going inside into the uterus, and uterus is getting big, big, big like a balloon. So this balloon is gonna push against this whole abdominal muscles. So the push will be there depending upon the 6 month, 7 month, 8 month, more big push will be there, and this is gonna create more and more stretching. If the person is having a good abdominal muscles. Her muscles were so strong before a good enough number of the diameter of the abdominal muscles were also good, and strength was also very good. So those females, the muscles are strong enough to have this strain coming out from the uterus. So might be stretching happens into the muscles, and the load is taken by the muscles because muscles were strong. But the female whose those muscles were not strong, so they might go for stretching, more stretching happens into that, and that might the load will go towards the linea alba. So depending upon that, mostly everyone is getting this separation during the pregnancy. After that, depending upon the healing process, as soon as we deliver the baby, our body goes under the healing. So what is this healing? What happens into this 45 days and 60 days plus program? Hormones comes. So the way the hormones were coming during the pregnancy to create this stretching everywhere, stretching of the uterus, stretching of uterine wall, stretching of the abdominals, the pelvic floor muscles, the connective tissue, ligament, everything was under the fact of the stretching. Now it is the body itself internal responsibility to heal the body. So it is not we like body is going to release those hormones again in postnatal time period when body will heal up. So these hormones will bring to the 100% peak. So as soon as you will deliver the baby, the healing hormone will come, and they are going to stay in our body up to 1 year. So healing is keep going on for up to 1 year. So it is not a small process. Big change happened during pregnancy. This is what I always believe, that 9 months has taken to create the change during the pregnancy, trimester wise. Same way after the childbirth, again 9 months, body needs for recovery. So it's within 9 months, whatever changes happen during the pregnancy, body will correct itself. It's the mother nature. Okay, so we don't have to do anything. Only one thing which is important here: give rest, the better rest and better nutrition. You just support your body. If you take rest, and you will not do unnecessary straining work, the automatically whatever linea alba separation everything has happened, it will be corrected automatically. It will be corrected within 3 months. But if it is not corrected within itself, so it means something is there which is not letting the abdominal muscles to come closer to each other. Might be some kind of tightness in other muscles or posterior structures. So release the tightness from posterior, let this come together, and we will then start isometrics. Then we will start working onto the abdominal muscle strengthening protocol. Okay, starting from this isometrics and all this kind of exercise we can add, where you can bring the linea alba together, you can bring this transverse abdominal muscles together, and don't do anything which can create a separation, making it away from each other. No, so avoid those activities and do those turning, those muscle movement which bring them closer. So this is what we can do. We can start after 3 months. Okay. Again, it's a big topic. You can definitely we have a courses for that as well. You can join us for the courses. We have a recorded videos for that as well. You can buy those videos as well. Okay. When patient is advised not to move in cervical circulage, how can we do prescribed movement? Hi dear, look, we have to understand that we have to give her circulation exercise, everything. We will not let the patient to sit down. We will not give any exercise in sitting and standing. We can give all the exercise in silent position. So let the patient stay in the bed in silent position, and or quadruped position. We can always support. It's a position which we have to avoid as a physio. Why doctor is telling her to avoid go for complete bed rest? Because they want to avoid strain downward over the cervix. And same way, we don't have to give that position which will strain downward on the cervix. So avoid that position, like sitting. If I sit down, the strain will definitely going to go downward. The baby weight, the abdominal weight will come down onto the cervix, and there are chances that it will affect my cervix. And if I'll stand up, so the whole the weight of the abdomen will also go down, and the gravity will also pull it down. So this is also not good. So sitting and standing is not good. That's why doctors are telling her to go for bed rest. Okay, supine position or bed rest actually. So in this bed rest position, can we do something in quadruped? Is it quadruped is also restricted? No, quadruped is not restricted, because quadruped, the weight of the baby body is not going. So it's assume the animal position. So when female is in an animal position on their four, so the load is going on to the abdominal muscle. It will not go towards the pelvic floor muscle. It will not go towards the downward side. Okay, it will not go down. So this is what you have to understand, that okay, we cannot give her any exercise in stand sitting. If she's sitting like that, the weight of the baby is going to fall down onto the cervix. We don't want that. So let me open this for you to make you more understand. So look, so we don't want her to sit down. If she will sit down, the baby's the pressure will happen, will start falling onto the cervix. This is the cervix where the circulation has happened. So no, don't give her a sitting, don't give her a standing, give her sideline position, quadruped position, all the exercise. You can give her starting from the toe movement to hand movement, back movement, everything you can give her into the sideline and quadruped position. Always safe and always healthy. It will improve the blood supply, it will reduce the pressure from the sacrum, it will reduce the pressure from these nerves, because nerves will be also under the effect of this compressions also. So definitely we can do a lot. And for understanding this, you can always enroll into my women health uh, courses. I have a lot of courses in women health, puberty, uh, um, puberty and adolescent health rehab course I'm having. Vulvovaginal and sexual health course is also there. Reproductive health course is there. Pregnancy course is there. Postnatal course is there. Pelvic floor course is there. This is what I'm doing since many years. So I have some sort of understanding, and you can definitely get this understanding. Whatever I know, you can definitely learn with me. Okay. Any specific exercise for infertility, I told you already. But all the girl, the message from me today is that mobility is very important and circulation is very important. Stay healthy, stay happy, love yourself, because your happiness is affecting your hypothalamus, and your hypothalamus is the master gland which is affecting your ovaries, your eggs. And the second is very important thing is exercise to improve the blood supply towards the reproductive organs, improve the blood supply towards the ovary, uterus. So the first important thing is the sex. Have sex regularly, not regularly, but whenever sex is very important, because whenever we are into the sexual activity, blood supply comes a lot. It rushes towards the vulva, towards the downward part. So sexual activities can increase the blood supply. Second, it not can, they will increase the blood supply into the reproductive system. So having sexual activity minimum 15 to 18 times in a month is good for the reproductive system. So 15 to 18 times. Okay. For male, the sexual activity should be 21 times. Not sexual activity, it should be ejaculation. Ejaculation should be 21 times in a month as per WHO. Why 21 times? Because if you really want to have a good prostate health, so 21 times ejaculation in a month is must. Any male who's not ejaculating, uh, like regularly, and they're not ejaculating, so they are ended up into the prostate issues in their life, as per the new studies which came into the March 2024. You can go for that as well. You can read them. And for female, 15 to 18 times is very good for improving the blood supply into your reproductive system. Second is legs on the wall. So whenever you are going for sleeping, whenever you're on your bed, so before going to sleep, put your legs on the wall for 15 to 20 minutes. It will help to bring the blood back towards the reproductive system, and it is very healthy. And the third exercise is pelvic floor strengthening. Keep strengthening your pelvic floor muscles, so they will also help in improving the blood circulation into that whole vulval region and pelvic floor region and the reproductive system, around the reproductive system. Fourth is a pelvic bridging. So these are the four things which I think every us we should be always giving doing, male or female sexual activity. The second is legs on the wall, third is the pelvic bridging, and fourth is a pelvic floor muscle exercise. And core strengthening, don't forget about core strengthening as well. Strengthening exercises which increase the blood supply and movement, everything into the core, they are also very effective. But core strengthening is not good for the person who is having adhesions inside and restrictions inside. Okay, so this is not good for that. So this is my question to that, answer to that question. Okay, let me see if there's another question. Okay, I think I tried. How to correct the fallopian tubes to the correct position? Any specific exercise? Hi, dear. First, we have to understand where exactly the fallopian tubes. So there's some specific protocols to check that. So through the transvaginal approach, you can insert the finger inside the female vagina and you can palpate the cervix, and after palpating the cervix you can get to know where exactly the cervix is lying, what is the position of the cervix. This is going to give you the idea where the uterus will be there, okay, where the uterus is falling. If the cervix is anteriorly placed, cervix is anteriorly palpable, it means the uterus is posterior. If the cervix is posterior, it means the uterus is anterior. If the cervix is right, it means the uterus is left. So same way that transvaginal palpations are important, which you can learn with me into pelvic floor rehab workshops and fertility workshops also. And this is going to give you the idea and where exactly your uterus is, and uterus means the fallopian tubes are. Is it possible to pelvic floor training while doing masters? And yeah, dear, it's like, nothing is going to stop you if you are the someone who is only you have done your masters in sports, for example. If if any pregnant will female will come, is it that you can't give her exercise? You can give her exercise because pregnancy was a part of our syllabus. We are physiotherapists, nothing can stop you. If you have a bachelor's of physiotherapy degree, so everything was a part of in our bachelor's syllabus. There was a small, in a small amount, pelvic floor was only three lines, but it was a part of our syllabus. So definitely you can always give, you can always learn pelvic floor wherever you are. You're working in cardiopulmonary, you are working in sports, you are everywhere. The pelvic floor is important. In musculoskeletal, pelvic floor is must because you are treating that back, and pelvic floor muscles are, you can understand, these are the sacrum, so they're attaching to the sacrum, so these are muscles, so no one can stop you. Or doing masters in gynec, no, it's nothing like that. Where you want to excel yourself, that is your choice. But you have to have understanding of everything because patient can come. You should never say them no. And this nowadays we have this kind of workshops are going on to keep learning. Enroll yourself into workshops, excel yourself, get more understanding, connect with the people who are masters into that, and they will be there to help you as well, support you as well. So choose a good instructors and learn with them who are going to support you throughout the life if possible. So no, if you are a physiotherapist, definitely can do anything related to the physiotherapy. I'm telling you to do infertility as well. Okay. All right, everyone. I hope you are you all are good, and I'll see you next in future whenever we'll get any opportunity. Okay, take care of yourself. Bye. Hope you liked it, and don't forget to follow me on Instagram and Facebook. Please give your review as well, and yeah, all the best to all of us. uh, Future is very wise in, in physiotherapy, I can see that. Okay, bye, take care, bye. I'm ending the meeting.